Hello, everyone, and welcome to another special live edition of Oxwide. And you can tell it's live. I've just had a bad network notification on my laptop, but bear with me if my sound's dropping in and out. Again, we'll be using this broadcast to try and address some of the concerns you may have around what's going on with COVID-19 and about the regulations and best practices that are falling out from it. Later in the programme, I'll be joined by Rachel Evans, our Director of Estates and Facilities, and Rachel is Gold Command of our Incident Control Centre, and that means she's kind of top of the tree within the organisation in terms of responsibility for managing our response to the incident. And Rachel will be able to help answer some of the questions and concerns that we've heard through our various channels, and also to talk to me a bit about the fact that we are in a situation that's changing rapidly, and we need to be prepared to be relaxed and think about how we implement these changes in the kind of common sense ways we go through. So given the fact that we're in the middle of an unprecedented pandemic, getting a bit sick of the word unprecedented this year, it'd be very easy to forget another coronavirus that's around. And you might remember from some of the discussions we had earlier this year that coronaviruses are a type of virus. They get the name from the word corona, which means crown, because they're these little spiky things, and that's what the viruses look like. And there's a huge range of coronaviruses. The common cold's a coronavirus, and of course the flu, influenza, is a coronavirus. And it's still a real problem, especially during the winter months, and each year causes around 10,000 deaths in England and Wales, which is a stark figure in its own right. And the difference between the flu, influenza, and COVID-19 is that there is a tried and tested vaccine that works, and it does help reduce the transmission of flu within the community, and also has an effect in many cases on your own vulnerability to it. And it's everyone's duty in the NHS to ensure we're keeping our patients safe by protecting ourselves from flu, but also reducing the chance of us spreading the flu to people we will live with and the people we care for. And I suppose it's worth us thinking as we read all these stories in the press about the COVID vaccine and how hopes are pinned on that for some kind of return to a more normal way of life. Actually, we do already have access to a safe, well-tolerated, tried and tested vaccine that can offer us protection from another illness that can cause long-term ill health and can kill if you're vulnerable to it. So last week, Lisa Tan spoke to our Director of Nursing, Jane Wells, and to our Deputy Medical Director, Dr. Tom Clark, about this year's flu campaign that is in the process of launching across the Trust. And here's what Jane, Tom and Lisa had to say.
Hi, it's Lisa. I'm joined today by Jane Wells, our Director of Nursing, and Tom Clark, our Deputy Medical Director. And we're going to be talking about the flu campaign, the up-and-coming season, and how we'll be doing things this time around, and whether or not things are going to be very different given the situation. So if we could start with you, Tom, why is it important that people have the flu vaccination?
Thank you very much, Lisa. Well, look, it's so important, Lisa. I guess as healthcare workers, we have potentially greater exposure to influenza and getting the illness. And I guess whilst we're all familiar with the sort of symptoms it can give us, with a cough and fever and feeling unwell, most of us will probably be sort of fine after a few days off work potentially. But I guess the main anxiety I have about the influenza is that the impact it can have on more vulnerable individuals, and that there's the potential for us to pass it to people who can have more serious sort of illnesses as a result of it. So thinking about young children, pregnant women, older adults, or people with long-term conditions who may need to seek, healthcare advice, may need hospital admission, and it can also be fatal as well. And in England and Wales, some 11,000 people die every year from getting the flu. So it's incredibly important that we protect ourselves and our patients and our families from flu. And it's such a simple thing to do as well, to have a vaccine.
Lovely, thank you. And Jane, our campaign is about to start, so we've got some of the vaccine through already. Can you tell us a little bit more about what we'll be doing in the coming weeks?
Thank you, Lisa. We are really lucky. We had a good delivery of over 1,000 vaccines this week, so we're all ready to start the campaign properly from next week. We're going to start this by visiting teams. We have flu champions trained up in every directorate, and there's a handful of these under the leadership of a lead flu vaccinating champion. So we have got enough people to go to as many teams as possible to save teams having to come out. So we'll try and provide as many vaccinations in people's places of work over the first few weeks. We're going to have a couple of intensive weeks. They're called jabathons, where it's all hands to the deck, where every flu vaccinator, including myself, are out and about vaccinating anybody that would like to have a vaccination. And we really do urge everybody to consider it and to have a vaccine this year. And then we will be putting on the Ox, on the specific flu pages, details of where each directorate will also be running clinics for if people aren't able to access them through our visits, and also places where people can obtain the vaccination outside of work, so GP practices, pharmacists, etc. And we really would encourage people to tell us when they've had their vaccination somewhere else so that we can record this. We know that every year over the NHS, more and more people are having their flu vaccination, and we had our highest uptake in Oxleas last year. It's really important this year because not only are we looking at protecting people against flu, and every year we never really know how bad the flu may or may not be, but this year we have got the added complication of COVID. And we really need to protect our staff, protect our patients, and not overwhelm services. And we also know that our patients and their families are expecting us to have these vaccinations. And when they know that staff have had vaccinations, they're more likely to have it themselves. So we're really encouraging people to have their vaccinations as soon as possible and to make sure that they're encouraging others to do so. And if anybody has any problems obtaining or accessing a vaccination, they can let me know and I'll make sure that we put one of the flu champions in touch with them.
Lovely, thanks Jane, and we'll make sure that everything stays updated on the Ox so that everybody's got that as their place of reference. And Tom, if we move over to you, can you tell us why is it important that people have the vaccine now? Why now?
Well, it's a really good point, Lisa, and I think really now is the time. So when you have the vaccine, it takes about 2 weeks for you to develop an antibody response so that you're protected. So you have to bear that in mind, and we need people to have their vaccines before the flu season really sort of starts. I mean, it's any time sort of between now and February. So really the sooner the better to ensure that you're protected and you're protecting the patients that you're treating and your family members as well. And I'd just add in as well to some of Jane's points too, in that I guess in some ways we have a responsibility to the NHS. So it's under huge pressure, as we know, because we're feeling it day in, day out. There's all the existing work that we have and have to catch up upon because it was disrupted during the pandemic. There's now sadly a resurgence of COVID too. And then if we add flu into that over winter, there's a real danger we can overwhelm the health services. So, you know, we don't yet have a vaccine for coronavirus, but we have a vaccine for flu, and so there's really no excuse. We can get this done easily, and we don't need the additional pressure of having to deal with all the illness that could be caused by flu over the winter period. So it's a really important time. And just I was reading a few days ago that for every 10% increase in staff members that have a vaccine, there's a 10% reduction in staff sickness that corresponds to that. So that has huge implications in terms of how we can maintain our services over the winter period.
So really, there are no good reasons why not to have it at all. So we really want everybody to come along and have their flu vaccine. And even if you're working from home, during October, you'll have an opportunity to go to some of the pop-up clinics, won't you? So there's opportunity for everyone, and we'll make sure that everything is kept updated on the Ox. And so the takeaway message really is, please, everybody, have your vaccination and help us to help the winter pressures.
Yeah, that's right, Lisa. I mean, as Jane highlighted earlier, the pop-up clinics at the moment. I was really lucky to have my vaccination done yesterday at Eltham Community Hospital. It took 2 minutes filling in a form. very straightforward. And I had my vaccine, and I've moved on from it, knowing that in a few weeks' time I'll have the antibodies to be protected. So it really is incredibly straightforward. I guess what people sometimes are worried about is that they say they may get some symptoms and side effects of the vaccine, and there are potentially some minimal ones. Unfortunately, I've never had those, but clearly, like getting flu itself, the symptoms and side effects of that are far outweigh any side effects that you may get from a vaccine. So, much more serious complications as a result of getting the flu. So really, as you say, I would just encourage everyone to get in there and get the vaccine done at the nearest opportunity.
Thanks very much for that. Well, thanks for joining us, Jane and Tom, and we look forward to the highest figures ever this year for our flu vaccination campaign. Thank you.
Thank you.
Pleasure. Thank you.
Thanks to Lisa, Jane and Tom there for that update about the flu vaccine, and I'm looking forward, it's not the right word, but I am anticipating getting mine as soon as we get some new stocks in, so look out for information on the Ox. I'm joined today by Rachel Evans, who's our Director of Estates and Facilities, but also importantly at the minute is Gold for the Trust, Gold Command for our incident response. So Rachel, we've just stepped that up again, haven't we, in response to the rising rates of COVID in the community?
We have. We initially set up the Incident Control Centre back in March when the pandemic was ramping up, and we've been operating 7 days a week and having almost daily meetings through that time. Through the summer, we stepped that down a little bit when things were a bit calmer, but now the infection rate is increasing nationally. We're back up to meeting 3 days a week, and we've increased the comms that goes out now to staff so that we have our regular Ox communications goes out once a week, but we have now a COVID special Ox going out as well, so that we make sure we keep staff up to date with all the changes that are taking place.
And one of the changes that we've introduced recently is in response to the high demand for testing, because a number of us know from personal experience that trying to get tests through the national framework at the minute is proving quite frustrating. So tell us a bit about what we're offering at Queen Mary's.
Okay, I know a number of staff have found it quite difficult to get tests, and obviously we want our staff to get tests as quickly as possible. So we've set up a swabbing clinic at Queen Mary's Hospital. At the moment it's operating Monday to Friday, 10 till 1. And it's for staff and household family members who have symptoms. It's by appointment, so please don't just turn up, but make the appointment. All the information's on the Ox, and you can have a test there, and we'll get the results out to you as quickly as possible. At the moment, I think we've done about 95 tests, so it's running at about 15 to 20 tests a day, but we're looking to increase that capacity when we can get the lab capacity to support it.
And people are bringing their children in, aren't they, to be tested?
They are. There's quite a high demand, I think, for swabs for children.
So if staff members are out there and their kids are sent home, as happened to me 2 weeks ago because they've got a seasonal cold, and then we can try to get them that peace of mind and help people get back to work as soon as possible.
Okay.
And I suppose the other thing that gives people peace of mind at the minute is access to the right personal protective equipment. And I was at Pinewood on Friday and I saw Rod, Tina and the team, they were busy loading the truck to get out and do those deliveries. So have we really seen that demand for PPE step back up again?
I think the demand is increasing, but the supplies coming in are good. So we're in good shape in terms of the amount of PPE that we have. The only area we have some difficulties is clear masks. That certain services require clear masks to operate effectively, and we're doing our best to get those in, but the supplies are really short nationwide, so when we're getting them in, we're having to take decisions about which services have them and ration them, but everything else is coming in well. And as you say, Rod and Samantha are doing a fantastic job in the hub, keeping that going, and Eric and Tina to do the doing the delivery. So thanks very much to the 4 of them who are really keeping the show on the road in terms of the PPE.
And at the minute, though, there's no supply chain concerns about us running out of anything. And I heard we had, I think, 20 pallets delivered over the weekend as well. So.
We did. Rather more than we could cope with, but we had 20 pallets, yes.
All right. So and there's no prospect of us getting back in the maple room anytime soon, by the looks of it, when I've walked past it. Okay, so people can get access to testing if they work for Oxleas for themselves and for their families, and that applies to bank staff as well. Yeah. And also, we have suitable stocks of PPE at the minute as well, so make sure in your order that you're holding enough stock for the business as usual requirements. We don't want people stockpiling big piles of things, do we? There's enough in the system to go around. We didn't run it earlier this year, and I think Rachel, the sense I get is we're in a better position now than we were maybe earlier this year in terms of the supply chain. Okay, we get to get those see-through masks in again, because I know that for some of the staffs and patient groups, that's really important. Now, obviously, the guidance is evolving, isn't it? Because we're seeing these high rates in the community. And we've had some questions coming in about the use of masks. And we've started a campaign about the use of masks, Rachel. I mean, what we've had a couple of conversations about this. Do you want to say a bit about where we are with this and where people can find out the latest?
Yeah, I mean, I think the general guidance hasn't changed at the moment. So our general IPC guidance is around good hand hygiene, maintaining a 2 metre distance, cleaning touch points, doing your environmental risk assessment, and wearing fluid resistant masks in the right situations. But I think what we need to do is think about what those situations are. What we don't want to see is a spike in infections amongst our staff, particularly in areas where traditionally people haven't worn masks, so around office areas in clinical space, but also office areas in non-clinical areas. We just need to make sure that we're doing absolutely the right thing. So there's a conversation going on about that at the moment within the ICC and wider within the organisation, and we'll make sure that we communicate a really clear message around that in the next few days.
And we're very much in this position, aren't we, where the rules are very clear about where transmission occurs. We know it's when people are in close proximity to one another. And we know when there's not much fresh air around, and we know when people are there for prolonged periods of time. And that's where the 2 meters, the hand washing, etc., comes into play. So I suppose, what we're asking people to do is to look at the guidance, but also to exercise a bit of common sense locally and have a look at the environment they're in. And I believe there's a risk tool that people can use to help them with that.
There is. There's a corporate risk assessment guidance document that's available on the Ox, and people it will help people to think through what the mitigations might be in their particular areas. So I would encourage people to have a look at that again. We'd expect that they've done this some months ago, but it's always worth keeping an eye on it, particularly as services are ramping up. People are coming back to the office a little bit more to provide those services. Then it's worth looking at again, making sure that we're absolutely doing the best we can to keep our staff safe and to stop the transmission.
And I always think it's helpful to look at the environment you're in and think, do you know what, if I found out in a few weeks' time that this had been a place where there had been an outbreak, would I be surprised? And I think just to cast your eye around and think, do I feel comfortable that I'm far enough away from people, that we've got enough fresh air, that if we need to, we're protecting ourselves. So we'd encourage people to keep an eye on that stuff. Yeah. I mean, I suppose the big issue at the minute is it's a difficult situation. It kind of feels as though, once more onto the breach, and that's causing a bit of anxiety. And we are going to try to clarify and use and guidance as best we can. The key thing is wash hands, cover your face, make space for each other, and wear that PPE correctly. And we have got this mask campaign starting. I think there's no words about any lockdowns directly affecting the areas we're in at the minute, but we don't know yet. We've just got to keep responsive about that. And I suppose the key thing is to support and look out for each other. I mean, I suppose, Rachel, one of the things I found about the ICC calls and these touch points is that it gives us that chance just to let off steam as much as anything else. And that's important too, isn't it?
It is. I mean, it's a good way of keeping in touch with each other, which is the important thing to do at the moment when we're all working remotely, and just to share ideas and make sure that everyone's okay and coping, because it's difficult for everybody, both in their work lives but also in their personal lives. So being supportive of one another is part of the role.
And it's that whole thing about emotional PPE. There's some good stuff actually you can read up on that, and some good work's been done about making sure we've got that right psychological personal protection as well as the physical stuff for each other, and showing compassion to one another and empathy is important then. And I think we've had one of the webcast about why we're not using forehead thermometers. I've got one over about using them to screen people entering the establishments. And I think the response we've had is that diagnostic tool, and the advice from the MRA is the temperature screening will be relied on for the detection of the coronavirus. So I think that's the current position, and that's coming from one of our members of staff in the Earth Centre and the CMHT there. I have asked though if we can go back and check on that, because I suppose it won't tell you someone's got COVID, but equally if someone's got a temperature of 40 centigrade, it might be a helpful thing to know. So I think that's something we'll have to put on the Ox a bit later this week, and thanks to Jackie who sent that question in. And Rachel, are you aware of any other questions we've had in the course of the call?
No, nothing to me. Thank you.
Okay, so at this point, I suppose the key thing for us to think about today, keep an eye on the Ox, keep an eye on the weekly communications, and we'll keep doing these relatively informal trust broadcasts so you know what's going on in the wider world. And we can't emphasise how important it is to support and look after one another. We don't have a COVID-19 vaccine yet. Well, there's some promising ones in train, but if we're realistic, they're not going to come in time for this winter on any kind of wide scale. But we do have a flu one. Please do get yours. COVID-19 and the flu together is a horrible thought. In fact, the flu itself is bad enough. So, you know, there's a good vaccine there. So we need to make sure that we're accessing that, protecting ourselves, the people we live with, and the people we care for. Look at the Ox as a place to go for up-to-date advice, guidance, and questions. And, you know, in the absence of explicit advice, I'd say follow common sense and have a chat with the people around you and think what would be a sensible thing to do in light of the guidance that we've got. You know, we don't have all the answers, but we'll certainly try to be as responsive as we can. So, Rachel, anything you wanted to add before we bring today's broadcast?
No, that's fine. Thank you very much.
Okay, so thanks, Rachel. Thanks to Lisa, Tom, and Jane, and thanks as ever to Steve Cooksley, who's behind the scenes making this all happen. All right, folks, have a good week, and we'll speak to you again very soon.
Bye-bye.